I'm interested in health innovations because I want to be in a position to not only create but come up with something that I can see it making an impact out there. I've been involved in discussions about coming up with quality healthcare. Is something that I'm really passionate about, and it generally makes me happy.
Sometimes you meet patients who have a lot of problems and you can't fix them all, but I think along the way coming up with some solutions that can help some of them would be very good.
As a physician who has worked in various settings in East Africa, I have encountered various health inequities that have often been normalized and overlooked. This is the core reason that I pursued a career in global health.
I believe that the average Kenyan citizen should be able to access professional healthcare when needed. As a biomedical engineer, one of my passions is advancing our healthcare systems in the country. In doing this, we find localized solutions to fit our population. In addition, we carry out research into creating new machines that would be cost-effective for our hospitals to acquire.
Within our own ecosystem, we have a lot of potential, and these has remained untapped.
Every year we see students coming in, they already bring in their own intervention. They said they want to do this, they want to do that, but they never understood the process of valuable intervention. Only because you have an idea doesn't mean that people need the idea. And the idea of biodesign education is we need to understand what the end users need, and by training the students to go through this process, changing the mindset that we have to create process, we have to create intervention based on the need of the user is the most important part.
To learn that there is a process to innovating in the medtech space, and more than that, I have learned that it's possible for anyone to be an innovator because there's a roadmap and a book to it, and I'm glad that Biodesign is bringing that to East Africa, where it's going to be empowering a lot more intelligent and capable young people and walk them through this biodesign process.
At Stanford Biodesign, we are very proud of our tradition of enabling medical device and health technology innovation. We believe that we have a methodology that enables innovators to develop user-centric, patient-centric solutions anywhere in the world. We're extremely excited about the East Africa Biodesign program because it allows us to share this methodology with a new region, with new partners, and enable local innovation for local needs and to benefit patients everywhere.
There are strong institutions, universities, both on the medicine side as well as on the engineering side. There's a strong entrepreneurial culture, and the region of East Africa as a consolidated block of countries represents around 500 million people. And we were looking for a region that had the scale that would attract investment because the market would be significant enough. And we've learned that from our experiences in smaller countries. And so we wanted a region that would have the size that could justify the investment in often expensive health technology projects.
Key to the biodesign philosophy is that we know we cannot solve these problems sitting over here in California. In fact, we know that we probably cannot solve these problems even if we just visit. What we understand is that we have to train innovators who live there, who understand the parameters, the challenges, the opportunities, the needs firsthand. And that's why we are starting East Africa Biodesign in partnership with the University of Global Health Equity and the University of Rwanda.
My hope is to see our graduates be able to create companies around medical devices and start helping our communities. Stanford Biodesign is an excellent partner because, as you know, Stanford is in the ecosystem of Silicon Valley, and we are dreaming that in Rwanda, the Kigali Innovation City become our Silicon Valley in order to start companies, but companies with impact.
Since we have started the training, for example, now we have a trainee who is attending the training at Biodesign Center at Stanford, together with a colleague from University of Global Equity. Others next year are going. So we hope in 10 years we will have a good people, good number to train others, but also we shall have trained others from within here, from Rwanda, within the Biodesign program that will start at the center.
As an engineer, I want to work on the most meaningful problems in the region. East African Biodesign gives me the opportunity to work in collaboration with colleagues from different disciplines to train aspiring innovators whose inventions will have a big impact on patients' experience and on patients' outcomes in the region.
I'm so happy to be meeting our East African colleagues because I used to live in Kenya, used to teach at one of the universities here, and so for me it's very exciting to come back and to be able to work with these incredible students and faculty. And when I worked here before, I knew there was so much incredible potential, and we see that. I think it's very exciting that Stanford can be part of this program.
The Stanford Biodesign program, being at the front end of the innovation process, sort of the needs finding, immersion into the clinical arena, will really set the stage well for making sure that we are developing and designing the right products. What is really exciting about that is as Avil Africa is coming in to take on startups that we're going to commercialize, it will be wonderful to know that a lot of work has been done in really understanding the needs of the patients, the needs of the healthcare institutions, so that whatever product is being developed and that we're helping to commercialize is something that has been very clearly thought through. I think also the building of that capacity among our entrepreneurs, our engineers, our clinicians is just going to be something that's really going to help the whole ecosystem, the whole healthcare innovation ecosystem.
The future is very exciting because the silos are coming down. People are talking. We have the medical team of clinicians talking to the engineers, talking to the pharmacists, they are talking to the users. So everyone is talking. That means we can solve problems that the user is feeling.
There's something in the air right now. We're building some momentum towards having a medtech industry, and adding anything that we can add that improves and increases that capacity can only be a good thing.
If you have an entrepreneurial background, have local domain expertise, are interested in mentoring our trainees or supporting any of the entities that will hopefully come out of this program, we would love to have your support.